called this meeting to talk to you about what's happened with our health insurance renewal so that you'll understand why we did what we did and talk about uh, what changes there were. Each year we renew our health insurance, and the renewal is based on the claims that were filed on behalf of employees during the past year. We started off about 6, 8 weeks ago with Cigna, our current carrier, saying based on our experience, they wanted to increase our premiums by 45%, and which is clearly an amount that we could not afford. And the reasons for that are based on claims that we could not have done anything about, which are problem pregnancies. Claims that we could have done something about, people who with certain conditions didn't exert the care they needed to protect their health, and visits to the emergency room rather than urgent care centers. We worked with Cigna, and they would not come below a 30% increase. We went to the other existing major healthcare carriers who could provide coverage to us in both New York and New Jersey. Aetna declined to bid because they just felt they couldn't be competitive. We got much more competitive bids with United and Blue Cross, and decided that in order to make healthcare affordable to both employees and the organization, that we would go with Blue Cross. But the only way we could get the premium adjustment down to an affordable level for Blue Cross was to make certain adjustments in both out-of-pocket costs for employees for healthcare, as well as the premiums that they pay. So that's what happened, and we'll go ahead and show you some of the differences in the coverage and the premiums. At any point during the discussion, if you have any questions, you could put them in the chat room to make it easier. And what you see here now are the two plans. We've combined both New York and New Jersey. There's the core plan, which is the basic plan, and the buy-up plan for people who want more coverage. But you'll notice in the premiums, most of the benefits in the Cigna plan are the same as the Blue Cross. There are some changes. One, as I said, is in the deductible. The core plan had been $1,000 per individual, $2,000 per either couple, employee with child, or family. That was raised to $1,500 per individual, $3,000 per family. In the buy-up plan, the deductible is $1,000 per person, $2,000 per family. That had been $750 and $1,500 per family. The out-of-pocket maximum in the basic plan goes to $6,600 per individual, $13,200 per couple, employee, child, or family. Because one of the big factors, I think, was the use of emergency rooms. Emergency rooms and talking about use of emergency rooms where there is not a hospitalization. If you go into the emergency room, you get hospitalized, you belonged in the emergency room. If you went to the emergency room and did not get hospitalized, you should have gone to an urgent care center, which is substantially cheaper. So one of the things that we did was to increase the payment that employees make who go to the emergency room from $150 to $500. Again, we want to encourage the urgent care visits, which will save everyone a lot of money. The final place where the plans are different has to do with the deductible for prescription drugs. This deductible does not apply for basic generics. You notice there are 3 tiers. So if you're paying the lower amount, there will not be a deductible. If you have something that isn't a generic, you will have to pay the first $100. It's important that you talk to your doctors about this so that if there are generics involved, they understand it and prescribe it. At this point, I will stop, and if you have any questions, put them into chat, or in chat, raise your hand to do so. So I'll wait a moment for people to think about, if they have any questions about what happened here and what the differences in the plan are.
Oh, hi, good afternoon. I just joined to the meeting. It's possible that you repeat what you were talking about?
Excuse me?
Can you repeat, please, what you were saying?
Yes. And what do you want me to repeat?
From the beginning, I just joined in the meeting.
Okay. I was explaining that we had to change carriers to Blue Cross because Cigna would only renew us at a 30% increase in the cost of the health plan, which was just unaffordable. The amount that we would have to charge employees and that the agency would have to pay, we just could not sustain.
Okay.
Yeah, the other thing I'd just like to say, Steve, I am recording this session.
Good.
We will put the recording up. So if there's anything that you've missed, it takes a while for Zoom to send it to us, but we'll send out an email and put a link. I'll have to check with Jim if we do it on Paycom, but then you'll have the opportunity to look again.
Okay, I have some questions. The first one is, what's a deductible? If you look at a deductible is the amount that you pay out of pocket before the insurance kicks in to cover certain things. So for example, it says on the plan that if you visit your primary care physician, it's a $25 copay. But if your primary care physician charges $50 until you exhaust your deductible, you would pay the full $50. So while the insurance doesn't kick in, essentially, until you've gone through your deductible. Somebody asked to throw the spreadsheet up again. Can you do that? All right, also, there's a question here which says, can we have a copy of the, oops. So there's the spreadsheet again, which shows the difference. Can we be sent a copy of the plan summary you had a moment ago? Well, this is a very cursory summary of the plan. It goes into, it was mostly geared to explain what will be different. There will be, starting next week, meetings that will be held to really go over the plan in detail. This is just some of the changes that occurred, and there's a lot more to the plan than was here. So it's important that you go to one of these meetings to understand what's in each kind of plan and what works for you and your benefit. But that's essentially. And let me just make sure I'm getting all the questions. Spreadsheet. And right. Somebody asked, would it be possible to get Cigna via COBRA or something? The answer is no. If you're on Cigna, you're on the plan, starting February 1, you will be in the Blue Cross Blue Shield plan. You can only take COBRA when you leave the organization. And when you take COBRA, you must pay the full freight of the premium, not just the part that you're paying through your payroll deduction. And, for individual coverage, the percentage is higher, but if you're adding anyone to your plan, CFS is still paying at least 70% of your coverage. So if you're on the plan today, you will have to switch to Blue Cross Blue Shield February 1. And if your doctor's on Cigna, apparently there are about 98% of the doctors on Cigna are also on the Blue Cross plan. So it would be extremely doubtful that you would have to change doctors. No, it's not effective 1/1/21. It's effective February 1/21. You will have some time next couple of weeks to elect a plan. But after you've gone next week to one of the information sessions, I encourage you to respond very quickly so that you at least have a number that establishes you as a Blue Cross Blue Shield member February 1, so you don't have your number yet and you have to pay out of pocket till they straighten it out. It's important that you move quickly to enroll in which plan you want.
What's the staff's payment amount out of their paycheck every 2 weeks?
We will get into that shortly.
Okay.
There will be increases in staff payments. Whether or not it's significant, it depends what you choose and what you have. But there will be increases in staff payments. In some cases, it's not significant at all. In other cases, it's more. It depends on whether or not you have other members of your family on the plan. The individual increases are more modest. We'll go into that next after I get through this. All right. Yes, you could always cancel and not take insurance if you don't. Barbara, can you hold on that for a second? Let me get through that's your choice. I don't know whether or not you'll be able to cancel if you enroll. Anise, could you talk to Guy is the name about that and separately?
Sure. Yeah, I can.
Okay, so the co-payments will not be lower than, in other words, the premiums that you pay to secure coverage will not be lower. They will be higher. And as I said, I just want to get through these questions before going into that. Dental will...
Steve, I don't know if Joseph, I think that was from Joseph. Is the question about the copay for the physician rather than the employee contribution? Just to be clear what the question is.
Well, the employee contribution will be high. The copay for physicians is about the same. It's not a change from whether you see your primary care physician or specialist. Dental and vision will be through Empire. They're very small changes. I'm not going to go into it. Go to the meetings next week to get a more detailed Somebody's saying that Cigna has the deductible, and I don't know, the person who has a $300 deductible is certainly not with us. The choice, we have the higher deductible, that when you have a plan for a lot of employees, we have about 300 employees on it. A lot of employees have the plan for security, but they don't use it. So that the higher deductible keeps down the premiums for those people. And the people who use it pay more. But in general, it also keeps down the cost to the organization. So that's why the deductible is in there. Dental coverage, yes, it's changing. To Empire, as will those of you who choose vision, it will be the same. Are there any other questions about the coverage or why we change before we go on to the premiums that employees will pay for their insurance? Staff will be able to apply for vision care at the same time you do for your general plan. Both the vision care and the dental remain very similar. The only real change in dental has to do with orthodontia work. Again, for the purpose of why did we change? We could, and employees could not afford to keep Cigna with a 30% increase. While there are increases in the deductibles, it would have been outrageous for employees in terms of deductibles and premiums and co-pays, and for the organization. And that's why we changed them. Blue Cross is an excellent plan. Is the deductible amount for each family member in total? If you have more than one person on the plan, for example, the 1,000, 2,000, 1,000 deductible for an individual, 2,000 for the sum total of everyone on the plan. So if it's an employee and spouse, then it's 1,000 each. If it's employee with children or employee family, the total is 2,000. And I think I've got all of the questions. If you have any, feel free while we're talking about the employee contribution to chime in with questions. So Barbara, would you put down the employee contribution? Okay, so this, for the basic plan, which we call the core plan, we've divided the premiums that employees pay based on your income. So if you earn less than $40,000 a year, your per paycheck premium will be $1,750 per person. If you have a spouse involved, it'll be $255. If you have children, it's $210, and if you have family, it's $375. Now, while there's an increase, for example, in this from $15 to $17.50, you won't see a $2.50 reduction in your take-home pay. We've set up the plan so that it's a pre-tax benefit, so that you don't, whatever this amount is in your paycheck, it will be less taken out. If you make between $40,000 and $60,000, the individual premium will be $25. For a couple, $270. For employee and children, $225, and for family, $400. If you're over $60,000, the individual contribution will be $60 per paycheck, $300 for a couple, $250 for employee and child, and $425 for family. If you choose to buy up, you pay the same. It doesn't matter how much you make. It'll be $115 per paycheck for individual, $350 for a couple, $290 for employee and child, and $475 for family. again, I just want to emphasize that if you're adding people to your plan, CFS is still picking up at least 70% of the total cost of the premium. And if you just take an individual, it's much lower than that. Right now, there's some questions. The buy-up is if you go to the meetings, it will define the differences in the plan. For example, you're not paying as much in your deductible, but you're paying more for your coverage. So you need to figure out which works. For example, if you're making 40 to 60 and you decide to buy up, $90 a week would be taken out of your paycheck, to reduce your coverage, your deductible by $500 a year. So if you multiply 90 by 26 paychecks, you're probably better off sticking with the individual coverage. It will be cheaper for you. But you could ask somebody during the meetings to help you figure out which is in your best interest. Yes, it's a Blue Cross plan in both states, and it's the same plan in both states. Any other questions or comments? Now, the next steps, while you think if you have anything else on your mind, will be meetings next week with our broker to really explain in depth what the difference between the plans are, what the coverage is. Today's session was letting you know that the purpose of today's session was to let you know why we're changing plans. It's a big deal when you change a plan. We understand that. What some of the differences in the insurance are, and the differences in the cost to you. If when we leave here, if something comes up, either write it down and wait for the meetings, or contact HR. There's a question here. Do you know the tier or plan? What the tier or plan level? That's Uvi. I don't understand the question you're asking. If you'd unmute yourself and tell me what's on your mind, maybe I can do a better job of answering.
Steve, I don't know if this question, if this is, oh, I'm sorry, whoever asked it, go ahead. I think we had, Steve, the previous plan in New Jersey that we had a couple of years ago prior to Cigna had tier levels. I don't believe that this plan deals with that.
Okay. No, and it will be somewhat different because this plan is for New Jersey residents. This plan is coordinated out of Empire Blue Cross Blue Shield, which is a New York-based company, so it won't be the same. Also, the question is Open Health Plus. I'm not sure what the concern is there from. Also, from you, if you could ask that. In relation to another question, it's you will not need a referral to go to a specialist. That continues, and it's not the same as it was with the New Jersey plan. This is a different plan managed differently, and I've asked there some questions about this morning, and I've asked HR to speak to our broker to look into the differences between what you were used to in New Jersey and what will be happening here. So that should be part of next week's presentations. The other part, in case, is that I mentioned the presentations for you to really find out what's in the plan and what choice you want to make. And to remind you to make your choice early so that you're registered with Blue Cross Blue Shield and you don't have any gaps in coverage starting February 1. The registration will take, correct me if I'm wrong, Anise, that you will register via Paycom.
That is correct. We're doing it electronically this year, so there won't be any paper forms. We're going to have everybody log into Paycom. They'll receive a link, and they'll go right into the benefits section, and they'll be able to select their plans. There's also...
When will that occur?
We will do that as soon as we announce the dates for open enrollment to start.
Okay, great.
Okay, and then I just want to mention for those that do not want to pick the plan or do they decide to waive out of it, there is a section in Paycom that they will fill out that will check to say that they're going to waive the plan for this year.
Dental and vision will also, as per another question, dental and vision will also be with Blue Cross Blue Shield. As I said, with dental, the only substantial changes with orthodontia. Otherwise, the plans are very similar to the one with Cigna. The insurance companies give you a better deal if you take dental and vision with your health. So that's why it's all switching. And I would encourage you, in terms of if you have any, for example, medication that may run out towards the beginning of February, any other things that you're concerned about making sure you have by February 1, do it before then through Cigna, where it will be covered the same way it's been. And you won't have to worry about any timing issues. Okay, Cigna, the last day, someone says what they would say, January 31st, 2021 is the last day you'll be on Cigna. February 1, 2021, you will be on Blue Cross Blue Shield. Yes, whether or not you, Anise, do you know if you could be treated in another state on this plan, or does that have to be New York or New Jersey?
I think it may have to be New York or New Jersey, but it also has to deal with people. If it's in New York and New Jersey, it definitely has to be in network. So if you're out of network, if you're crossing state lines, you may be considered out of network and you may be charged for that.
And yes, there are in-network doctors and hospitals. The analysis that the broker made is that 98% of the doctors in Cigna are also in the Blue Cross Blue Shield plan. So the likelihood is that the doctor you see now in the hospital you go to will also be on the plan. Yes, the dental, vision, and care plan are all going to be Blue Cross Blue Shield. Any other questions, comments? Up here. Okay, I don't see anything. So again, if when we hang up and something comes to your mind, either write it down and wait to ask the question at next week's meetings to really explain in detail the plan, or shoot it off to HR and allow them to it says something about a new message. The only differences in coverage generally between this and Cigna are the ones that I outlined for you. There are higher deductibles. In some cases, higher out-of-pocket expenses that you would incur. The cost of going to the emergency room is significantly greater. And for certain kinds of prescription drugs, there will be a $100 deductible. Otherwise, all the other coverages are pretty much the same. And there'll be more detail, again, there'll be more detail next week at the meeting set up to go and to explain the coverage in greater detail to you. So again, if something comes up, we're about to end the meeting, email HR, they'll answer your questions, come to meetings next week. You'll get a lot of detail about what exactly it is and how to enroll. Thank you all for coming and attending the meeting, and we'll keep you informed as to what's going on. Have a good rest of the day, everyone.
Happy New Year, everyone.
Yes, a happy and healthy New Year to all.
Yes,
Thank
happy
you.
Happy New Year.
Same to you as well. Thank you.